Of course, we can add in more good fats in the diet. Then comes the questions, what are the good fats? Hi, my name is Hui Sin. I'm actually a dietitian from River Physio. So my role is to help the patients to recover fast, and also if they have any problems with weight, I was able to actually help them to manage their weight better as well. People were quite surprised that River Physio has a dietitian, and what is the role of the dietitians. So what I do for the clients will be really to help them to look into their diet, and then planning a personalized meal plan for them, helping them to recover faster. And also if let's say they would like to improve in terms of their strength, it will need actually adequate protein from the diet as well. So what is the difference between dietitians and nutritionists? Usually a nutritionist, they are actually graduated from a nutrition course, but they will be a bit lacking in terms of the clinical skills, whereas dietitians do work in clinical settings, usually in hospitals, where we work with clinical teams like doctors, nurses, and also other allied health like physiotherapies, occupational therapies, music therapies, and also speech therapies. I specialize in weight management and also helping people to recover from their injuries, surgery. I do see patients, cancer patients, be it when they are in the treatment or post-treatment. There are many nutritional informations, all over the place on the internet, but which one is true? So I think by asking our dietitians, you will actually really get the answer out of it. And sometimes like practical strategies, people will know that yes, I need to lose weight, I need to count my calories, I need to reduce my calories, I need to eat healthily, but in what way that actually that fits into their schedule, their lifestyles, their preferences, so then a dietitian actually can do a better job. So usually in the first session, we will do a dietary assessment, looking into your diet plan, the usual one, and then from there we will look into what are the goals actually to be achieved. For example, weight management, we are looking at reducing weight, and there will be a need actually for restricting calories intake. And how can we do that? By actually managing the portion sizes, by swapping to a healthier choices, and it also usually the advice will be really fit into your own preferences, because not everyone eats or order food, and certain people has a different preferences, and we still can actually plan maybe a diet plan for you to follow by taking into account of your preferences, and also some people might not be able to prepare their foods, and then they will be looking at really ready to make or ready to eat kind of foods. So that's when it makes a difference to see a dietitian for a weight loss. And a lot of time with the support, usually the program runs about 3 months. Then during that period, you'll be also sort of like getting or inquiring actually the skills of like planning your meals, and then learning how to read labels. So you might be able to get this information there or from somewhere else, or maybe hearing from your friends, but sometimes it's a little bit difficult to sort of like differentiate between like a false fact, or is it really a real thing that we should be following. So simply just eating fruits. People were saying that fruits has sugars. Should I be eating fruits? But fruits also has fiber, have other vitamins. So then the question is, can diabetic patients eat fruits? So I think people will be quite scared when they have a diagnosis of like pre-diabetes or diabetes. Then they will totally avoid like the major sugar sources like fruits. But in fact, what they need to actually control will be really the added sugars, like refined sugars, white sugars, honeys that added into their cooking or drinks. And instead of like avoiding fruits at all, which gives them the nutrients and the minerals and the vitamins the body needs. During the 3-month program, the clients actually get to learn about their really the whole day intake, where they actually, some of them actually are very motivated. They jot down the foods they eat, they do a food diary, or some may use actually applications to help them to track their food intake. And with that, they are quite surprised with the calorie intake they are probably consuming in a day. And that's why sometimes even if they cut down the foods but they are not seeing the results. So as a dietitian, I'm here to guide you along the way and also to really help you to effectively lose weight if you are looking at losing weight. But of course, not everybody needs weight loss. Some people, they are not eating well. They probably are suffering from certain acute illnesses that prevent them from maintaining at a healthy weight range. So then they are struggling with weight gain, and then no matter how they eat, and then they are not actually gaining weight. So that's also another problem that usually the clients are facing. So by eating healthily, of course, we can add in more good fats in the diet. Then comes the questions, what are the good fats? Then sometimes people say coconut oil is good, and all the company, they actually promoted coconut oil as a weight loss product. But is that true? So in fact, scientifically, coconut oil are higher in terms of saturated fats. And these saturated fats can increase the cholesterol level in the body. So sometimes it's also looking at the quality. So small amount might be fine, but if you are taking into like a large amount, then you'll be a problem actually to your health. Usually there will be actually a general meal plan, like the portion sizes that guide you along, and usually each meal will come with a balanced diet where you have your carbs, preferably from the whole grains, and your proteins. It could be from the animal or the plant sources, and also the vegetables. So there will be certain guidelines in terms of portion sizes, how much you should be eating, a palm size of meat, or half a bowl of vegetables, or how much of the fruits in a day. And then from there, if you're following the portion sizes, it should not be actually preventing you from actually achieving the goals. So of course, the way that the foods are being prepared, and that also sometimes somewhat make people actually underestimate how much calories that they are consuming it. It's not really like a struggle for them to follow the meal plan, because I will plan that based on what is their usual intake. So with that, I'm adjusting a little bit on the portion sizes, and of course to include what is actually needed, what are the healthy options if possible, and cutting down the frequency of those not so healthy kind of choices. So they are still enjoying the types of foods they prefer, but to a lesser extent in terms of the frequency. Then they will be seeing like the protein intake, whether they are getting enough or not, and also if let's say the apps allows them to actually track also the fiber intake, which is actually quite lacking in a common or modern diet right now if they don't actually make an effort to eat more fruits and vegetables. So these are the things that some people might be quite surprised when they start to track their meal. Currently, there will be like a different so-called like a fad diet. For example, intermittent fasting, keto diet, and I have seen actually clients achieving good results from these diets, like intermittent fasting. So what it helps is really restricting the eating window, where they only eat in certain, actually maybe 8 hours in a day, if talking about the intermittent fasting. And that actually helps them to cut down the calories if they are eating healthily for maybe the 2 meals in a day. But I have also actually seen clients that practicing intermittent fasting but not seeing results. So they are eating really a lot at the 2 meals, and then they are not taking care of the food choices as well. So that's when the diet doesn't work. Of course, lately I also actually attended a seminar where this professor actually shared about people doing intermittent fasting. Their basal metabolic rate actually is much lower than the same weight people. So that's when by having this intermittent fasting maybe being prolonged, and then it might actually reduce the metabolic rate, because our body tends to get the signal that we are not eating enough, and then that's why the body will start to conserve the energy. And some people might notice that their weight loss progress is also plateauing after a while. Then comes the exercise. So why do we want physios and dietitians working together in River Visual? Because with the dietitian's help, yes, we can cut down the calories, but we need the exercise to increase the metabolic rate, and then that will be really helpful in terms of long-term weight loss or weight maintenance. Because a lot of people, they might be losing weight quite good in the beginning, but it's actually a struggle for them to maintain that weight without proper exercising. So in terms of those weight loss drugs, like the injections, like weekly injections and all this, yes, I've seen clients actually having a good result after being actually put on the drugs. Yeah, so the drugs actually helps you to suppress your appetite, and really some clients might have no appetite to eat, or they are eating just one meal a day, and that actually forces them into a low-calorie diet, and therefore they are losing weight. But if, let's say, their lifestyle doesn't change and they are back on their maybe old way of eating and they're not exercising, having a sedentary behavior, I have also clients approaching me. He has actually lost weight when he was on the drugs, and then after the drug was taken off, then he put on all the weight back. Yeah, because there's no change in terms of dietary pattern, there's no change in terms of a sedentary lifestyle. It can be a good tool to help you to lose weight initially, but I think we really need help from the professionals to establish a better eating habit and also exercise regime to achieve the long-term weight maintenance. So there's this client who is a lady, not looking for weight loss, but in overall, she really wants to actually build her muscle, where she meets our physiotherapist, Anthony, and during the course of a few months, she has a prescribed regime, exercise regime to follow. But Anthony also actually slot in a dietitian's assessment just to look at the diet and making sure that she's getting enough protein. So nutrition does play an important role in building the muscles. So we are looking at really having a higher protein intake during that period when she does the exercise, and also to make sure that she sort of benefit from the program actually more effectively. For those who wants to lose weight effectively, with actually more confidence, and also really looking into changing your dietary habits, behaviors, your lifestyles, you can come to River Physio, where we have actually dietitians look into your diet, making sure that you are not deficient in terms of nutrients while having a calorie deficit to help with your weight loss. And at the same time, we are also helping you not to lose your muscle, where the physiotherapist will prescribe you with the exercise regime that can actually strengthen your muscles. Some people might find it challenging to track their meals and all this. So start off with, we will give you some simple steps to begin, in terms of transforming your diet into a better one. So do look out for us for some simple tips, and then that can change really your lifestyle, your diet, and also eventually your health outcomes. Hi, I'm Hui Xin. I'm actually from River Physio. If you do have any health problems, do look for us at River Physio.